for this test, we are going to be going through the 1RM back squat test. So for this test, you first want to gather your individual's basic health data and then take them through a 10-minute warm-up that includes dynamic exercises and static exercises for the lower body, because that is what we are testing. From there, from the warm-up, you want the subject to get into the squat rack and make sure everything is placed correctly. So Garrett, if you want to move forward and make sure that is at a good height when you go under it. So you want to make sure it's going to be a good height, so when they stand up, they're going to be able to easily move the bar out from under them and be able to re-rack it after they're done with their test. From there, you want to make sure that the individual knows how to use proper technique. And from there, you're going to have them do a warm-up of 60 to 80% of their perceived maximum. And after a minute rest, you are going to have them do it again. Once that is done, you're going to have the subject rest for 3 minutes while I will increase the load to correspond about 90% of the client's perceived maximum. After that is done, you're going to have them perform their 90% maximum again, but only one repetition at the increased load. You are going to continue increasing that maximum until they can no longer perform with good technique, or they cannot lift the weights by themselves. Once that is done, you are going to take that maximum value that they were able to lift for the 1RM, divide it by the body's body mass, and record it on the individual data sheet and compare it with the values in the normative table for the 1RM squat press, and based on the results, determine the subject strength classification and percentile rank on their data sheet.